find such a love at our age. Whoever thought we could dance on a...
Welcome to Couples Therapy in 7 Words. I'm your co-host, Judy Alexander, and I'm here with my husband, Dr. Bruce Chalmer.
Hello, Judy. Hello, viewers and listeners. Judy, what's today's title?
Help for the Sexless Marriage, an interview with Dr. Rachel MacNeill.
Yeah, wow, she's great. We've had
She
a
is
blast.
great.
It may be a slightly longer than usual or something. Folks, it's worth it. She's just really full of knowledge. And I found, and I was saying during the interview, early on, it's like, oh, mind blown,
Yeah.
I mean, stuff I just didn't know about how the pelvic floor operates and how it applies to, we talked a lot about sex, also how it applies to like urinary
Right,
incontinence
and
all that kind
the
of
whole
stuff.
system.
Yeah.
It's all related.
And she's just a lot of fun. We really enjoyed talking with her.
Yes, we did.
So check that out. And before we do that, let us talk about our various books.
Okay, well, in the interview, this actually, or was it?
No, it was afterward.
Post-interview?
Yeah,
okay.
we didn't cover it in the interview.
Sorry, I can't remember. The book that started our podcast was Reigniting the Spark, Why Stable Relationships Lose Intimacy and How to Get It Back.
Yep, that one came out as we're recording this just about exactly a few days past 5 years ago.
Yeah.
That's amazing.
That's right.
That was 5 years
right
ago.
as the pandemic was taking hold. And then after that book, you came out with It's Not About Communication, Why Everything You Know About Couples Therapy is Wrong.
Yes, and that one is about, get that one if you want to know how to make good use of couples therapy, if you want to know how to find couples therapy that probably will work better for you, and how to avoid couples therapy that probably will be a waste of time. I address a lot of that in that book. And
your latest book, Betrayal and Forgiveness, How to Navigate the Turmoil and Learn to Trust Again.
Yes, and if you've ever been betrayed, and if you've lived long enough, you probably have. I mean, I don't want to over-assume that, but most of us at one time or another have been hurt badly in a relationship. If you've lived long enough, you probably have. If you're fortunate not to, well, lucky you. But most of us have. And I'll tell you something, from having gone through that sort of thing, you learn a lot. And really, one of the bases of that book is that recognition that when you can get through it, you will come to be appreciative of what you've learned by having to go through it. And so if you've been betrayed recently and you're kind of still in the turmoil, get that book. If you were betrayed years ago and you're still upset about it when you think about it, get that book. Just get that book.
Yeah, it's very good.
Yeah.
I can vouch for it.
Indeed. Speaking of books that are very good.
Okay, so I guess you're talking about my book.
I am indeed.
Okay, that would be The Blue Tent, Erotic Tales from the Bible by Laria Zilber, my alter ego.
Let me spell that for folks who are not watching this. It's LARIA ZYLBER. If you go to lariazilber.com, you will get all sorts of information about that book and to get to see interviews with Laria herself.
Yes,
who,
Laria herself.
as I so often have pointed out, looks incredibly like you, except has blue hair.
She does have
She
blue
does
hair.
have blue hair,
Well,
but she looks just like you. It's the blue tent. She had to have blue hair. And but that book is wonderful, really sexy erotica, if I may say so.
Thank you.
So get a hold of that. So let's go to our interview.
Okay.
And we'll see you on the other side.
Our guest today is Dr. Rachel MacNeill. Rachel is a doctor of physical therapy practicing in pelvic floor rehabilitation and an ASEC-trained intimacy coach. She helps clients stoke desire, heighten arousal and climax, and reimagine the ways we create sexual fulfillment alone and with our partners. Her approach is informed by her own experiences as the survivor of a sexless marriage to a man, as a queer person, as a feminist, and as a progressive organizer. Rachel, welcome to Couples Therapy in 7 Words.
Awesome. Thank you so much for having me.
Well, we're delighted to have you. So we always like to start off with our guests asking, how did you get into the work you do? Tell us something about your own journey.
Yeah. So physical therapy in general is actually a second career for me. I was in corporate social responsibility and nonprofit fundraising for 10 years and realized it wasn't for me. And for a number of reasons, chose physical therapy. But I actually was not even familiar with pelvic floor physical therapy until I began studying. And so once I did, initially, and a lot of my pelvic floor PT work centers around incontinence in men and women, urinary incontinence. But I also treat a lot of women in particular for pain with sex. And it was actually a patient I had who I was seeing for incontinence. She was a woman in her 70s. And I always ask my patients the same question on eval. So, are you having sex and are you happy with frequency? And then, as far as you know, are you able to orgasm alone or with a partner? And my patient wasn't sure that she had ever had an orgasm. And I thought, well, if you don't know,
Yeah,
there's a good
probably
chance that
haven't.
you haven't. Right.
Yeah.
Exactly. Exactly. And so we got to talking about it a little bit. And, she was in her 70s. She had raised two boys. And I just thought, this is criminal, that this woman has gone her whole life and she's been having sex this whole time and is not sure really if she's achieved at least that kind of pleasure with it. So I had recommended to her a Hitachi Magic Wand, which is the Cadillac of vibrators to me. I recommend it to a lot of my clients.
Ah.
And she got one. And after she had had it for a number of weeks, she came back in and I said, oh, how's it going with that wand? And she said, well, I'm not sure that I'm using it correctly. And I thought, oh my gosh, this didn't even occur to me. I thought for sure she would know what she was doing, at least if she got it. And of course, she didn't. So she didn't have a great understanding of her anatomy, especially when it came to her anatomy around pleasure.
Mhm.
I assume with two kids, she had a sense of her reproductive anatomy in that regard. But so she just kind of inspired me. And since then, I've had a lot of patients like her to realize that. Just because someone has children, just because someone's been in a romantic relationship for a very long time, doesn't mean necessarily that they're enjoying themselves. And it could even mean that they've never had orgasm. And
Mm.
so that's kind of what kicked off the intimacy coaching side of my work. And then, as you mentioned, I was in a sexless marriage for years. And once I divorced, I realized there's a whole lot that we did in couples therapy that was focusing on our issues and our past and things like that. But that in a lot of couples therapy, there isn't really an opening for the here and now, what's fun, how can we move forward and be oriented toward the future in a way that doesn't have us constantly mired in past hurts or things like that. So I think couples therapy has its place. It's super important. And I always say the thing I like about my job is I'm not qualified as a couples therapist. So it is appropriate for people to see therapy when that is relevant to them. But I get to do the fun work of just, okay, how's intimacy and how are we going to start creating things in the here and now?
Yeah, yeah. You're reminding me of we interviewed someone years ago on our podcast, Batsheva Marcus, who is a sex therapist, and at the time she was the clinical director of a women's health center in New York City, and she wrote a book called Sex Points, where talking about the sort of multifactorial nature of sexual desire and how
Hmm.
everything tends to go. And one of the things she pointed out, she had a chapter in there, and I said to her, one of the things I liked about your chapter was that you were warning people against people like me, which I thought was a lot of fun. And she said, "Oh, no, 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 I'm not." And I said, "No, you really are." Because, and it's similar, because couples therapists, between the two of us, Judy's a retired educator. It's like she's the real person, I'm the therapist. Um, but what couples therapy tends to focus on is the relationship and how you're feeling about each other, and ignores often even just simple mechanics and
Yes.
potential medical issues, potential the sort of issues that a physical therapist would be able to address or an MD would be able to address. And
Right.
I'll finish with one story. You've heard this one several times before, but I was at a training a couple of years ago I was online, so it was like a couple hundred therapists in the room, and it was a training about couples therapy. And so everybody in there had at least interest in couples therapy, and most of us in there actually practice couples therapy. And the trainer asked, "Okay, how many of you ask about a couple's sex life in the first or second session, early on?" And I'm
Hmm.
thinking, well, of course, right? Obviously. And it was about a third. And the other
Yeah.
two-thirds were saying things like, "Oh, no, no, I'll wait for them to bring it up." And it was interesting to me, Rachel, when you were describing your initial evaluation, that you just routinely ask people about their sex lives. And I have to add one other thing, as a guy in my 70s. I was impressed that you asked a woman in her 70s about her sex life rather than assuming, oh, you're too old, you're not going to be having sex. So if you could
Yeah.
feel free to comment on any of that. That's what I was interested.
Yeah, absolutely. So I think, my clients typically are either retired women, which I love because I feel like oftentimes these are women who they've worked their whole lives, they've given so much their whole lives, and now they have an opportunity maybe to pause a little bit and to reflect on what's fulfilling for them. I think they sometimes have a little more time if they're done raising a family and things like that to begin to focus a little bit more on their pleasure. And if they know what that's like, then maybe they know right where to start. And again, if they don't, then I think it's a great opportunity to think, okay, what's the rest of my life going to look like? What's my relationship look like? And I'm actually, as an aside, I'm really motivated. Totally, as an aside, I'm really motivated by my own mortality. And so part of in my relationship, in my sexless marriage, when my therapist told me, Rachel, you're in a clinically defined sexless marriage, that hit me like a ton of bricks because I just thought, I'm going to die someday. And if I'm in this marriage to a man who is not interested in having a sexual relationship with me, but who monogamy is important to him, then I kind of felt like I was a prisoner in my own body in a way, where it's like he
Yeah.
really owns my sexuality. I can have a solo sex life as much as I want, but he's telling me, no, this is what partnered sex looks like for you. And because of kind of his stance, he was in charge. And so that really hit me a lot. But I think so that's kind of one group of my clients tends to be patients like the first one I described. And I think the other segment of my clients tends to be women who are new moms or raising a family, and they're giving, giving, giving all the time. And I think they get this rap often that they think they are not interested in sex. And my philosophy around that is anything we enjoy to do, you shouldn't have to convince us to do it, right? And
Mm.
so certainly there's low libido. There are medications people can take when that really is the case. Obviously, asexuality is a thing. But I think for most women who think they have low libido, and most women who have this dynamic with their male partners where it's like he really wants sex and she doesn't, most often I don't really think that's an issue of low libido. I think it's actually she's not sure what she wants. She gives all the time, and sex isn't a place where she gets to receive. It's another place she has to give. And so I'm really motivated by. I think we just don't always know what we want. And if we do, we don't necessarily know how to communicate it. And that's true for women, I think, across the lifespan. But at least when you're retired or when you've been around the block and you have a little bit of experience, I think you might actually have an advantage, both in terms of time and in terms of your own self knowledge that could be helpful.
Can you talk to us about what pelvic floor exercises are? Because frankly, I never heard about it until you came up and I started exploring what it was. And it's like, wow, that's a whole other field I had no knowledge of. And I'm sure that there are many people out there who might not have heard it. So why don't you tell us what it is and how it's used, and not just in sexual ways, but other ways as well. So go on.
Absolutely. I am happy to talk about this. It's a growing field, thankfully, and especially because urinary incontinence, as I said, which is a big part of what I treat, is not normal, is not something anyone should have to live with as part of normal aging, for example. And so I love that more and more people are figuring out that it exists. But in general, pelvic floor PT, there's a hammock of muscles that sits in our pelvis. They're muscles like any others in the body, so they need both full range of motion and strength in order to be able to function properly. And when that comes to issues of incontinence, that means if I go to hold it, do I have the range of motion and strength to do that? For most women, instead of strengthening, which I think is what we have traditionally thought we need to do if we're leaking, for example, we actually don't have a problem with strength. We have a problem with range of motion. And so the example I often give is with the bicep, right? If you put a heavy weight in my hand out here and you ask me to contract against it, it's going to be hard. The muscle fibers are far apart. They can't get purchase on one another. That's like 2% of the people I treat, and they're ready to strengthen right out the gate. So they're ready to do some of what we're familiar with as Kegels or things like that. But 98% of the people, and in particular the women I treat, are all the way up here. So now, if you put a heavy weight in my hand and you ask me to contract against it, there's nowhere for me to go. So I may
Mhm.
think I'm doing a Kegel or closing off, but if I'm already up here, it's not going to be effective. And so if I'm doing Kegels also with a pelvic floor that is really tight, I'm not going to strengthen this bicep until I get full range of motion at my elbow, right?
Mm.
And so most women and most people in general, the first thing they need to do is not Kegels. They need to focus on diaphragmatic breathing, manual therapies, things like that, that can get us full range of motion in the pelvic floor. And the way this relates to sex often is people who have pain with sex, in particular pain with penetration. It's called dyspareunia. And for those people, a lot of times they have a lot of that increased tone. And if I have a lot of that tone, whether it's at rest or because I'm guarding, maybe I have some trauma history that relates, maybe I'm guarding because I'm afraid of pain, whatever. Penetration could be painful for me then because it's like I'm getting this really unpleasant stretch of my tissue every time I'm attempting penetration. So pelvic floor plays a role in bowel, bladder, sexual function, also plays a role in how we manage intra-abdominal pressure, which is a whole other topic I could get into. But we're starting to realize that really with the diaphragm and some abdominal and back muscles is kind of the deepest core and the seat of my function in my limbs and with all the other things that I mentioned.
Wow.
So so you had mentioned some physical ways to correct it. So other than the Kegels, what are some of the other physical ways people can work on that?
Yeah, so pelvic floor is the bottom of a deep core canister of muscles. So the bottom sits in my pelvis, it's a hammock. My bladder, my uterus, my guts are all on top of my pelvic floor. So it's supporting everything in my abdomen. The top of the canister is my diaphragm. And my diaphragm and my pelvic floor, when I'm good at diaphragmatic breathing, my diaphragm is going to help to get me some good, natural, mechanical stretch, particularly on an inhalation. So stop me if this is too much detail. And I actually do have some videos that explain this on YouTube. I have like 5 videos. They're all about the breath. I definitely could share that link
I'm
with you
just
all.
thinking opera singers must be really good at this.
Yeah, so it's funny. I think singers sometimes are, but I think the challenge is my diaphragm sits at the base of my lungs. It's kind of where my bra band would be.
Hmm.
And when I'm engaging it, it should move left and right, front and back. And it's kind of like an umbrella orientation almost in my ribs. So when I inhale, my diaphragm should go down. Makes sense. It's going to make more room for my lungs. Because it goes down, negative pressure helps to suck air into my lungs and everything else follows. So diaphragm moves down, puts pressure on my guts, my belly may rise a little bit, and my guts put pressure on my pelvic floor. So my pelvic floor may descend a little bit. And the funny thing is, I bet singers are pretty good at this, but oftentimes I'll see yogis or people who do a lot of Pilates and they think, oh, yeah, I know diaphragmatic breathing. I do it all the time in practice. And when I go
Hmm.
to see it, they're used to cues like big belly breathing or fill
Mhm.
the bowl of your pelvis. And the problem with that is I can move my belly a whole lot when I breathe, and I'm not necessarily engaging my diaphragm. And in fact, if
Wow.
I'm used to big belly breathing, I may be putting unnecessary pressure on my pelvic floor, which can cause issues like prolapse and actually can increase tension because my pelvic floor is trying to brace for the extra tension coming down on it or the extra pressure coming down on it. So, diaphragmatic breathing is really nuanced. And I think I can share that link to the videos, like I said, and that can help people, I think, understand what I'm talking about. But I also think it's helpful if you're really struggling or you have some of these symptoms around pain with sex or incontinence to get seen by a pelvic floor PT to really make sure that you know when you're diaphragmatic breathing, you're moving the right things and that you're not putting that unnecessary pressure down.
Well,
Because
this is
again,
yeah, this
oh,
is just mind blowing. Wow. I mean, in terms of you're upending a bunch of unconscious assumptions I've made about how that works. And I do a fair amount of singing. I'm not a well-trained singer, but I do a lot of choral singing. I'm a composer, and I do a lot of music stuff. And have learned all about this diaphragmatic stuff and had no clue of what's going on underneath that. I'm only thinking about
Right.
what's happening in the lungs,
Yeah.
but what's going on underneath it. And I want to ask you another question, which may be a little off the wall, but you can tell me. Because I remember one of the things I'm trained in is hypnosis. I haven't used it for a while because I work with mostly
mm,
couples. But when people are talking about, you can maybe figure out what the connection is to this bizarre little association I have with that. When I've helped people, for example, have enuresis issues, that
Mhm.
sort of thing. One thing I'm fascinated by is, I don't have any difficulty with controlling when I pee and when I don't pee. I don't wet the
Mhm.
bed or anything like that. I don't know how to pee. I don't know how consciously how to say I'm going to pee. What am I doing? And is it different for men
Mm.
and for women? What the heck am I doing that allows urine to start flowing? I'm just standing there, man, standing in front of the toilet, thinking, okay, I want to pee now. And
Mhm.
magically it happens. As opposed to, like you said, with a bicep, I know what the heck I'm doing when I'm picking up an object. I don't know what
Mhm.
the heck I'm doing when I'm peeing, but it seems to work well. Like, what's going on? Yeah,
Thank
and
goodness
is
it
that
works
different for
well.
men? Yeah. Well, yeah, thank God, exactly, especially as a man in his 70s. It's like, yeah, I shouldn't take that for granted either, should I? Trust me.
Absolutely, absolutely.
But just in terms and is that different for men and for women? Like, what the heck's going on?
General control of urination. So prostate issues aside, because you're absolutely right.
Yes.
That's a unique experience for men. But generally speaking, peeing happens as a combination of contraction of my bladder that helps it to empty and relaxation of the sphincteric muscles around my urethra that allow me to open. So
Hmm.
that's kind of the general idea. But when it comes to pelvic physical therapy, the way I describe it often is peeing is it happens because of relaxation. I shouldn't have to push ever. And if I'm
Hmm.
having a slow stream or if I'm not completely empty, it's usually because I have some of these tension and tone issues we're talking about.
Yeah.
So when I'm talking to people about the normal mechanics of urination, I usually describe it like it's like a cave with a boulder in front of it. So if I sit down to pee
Ah,
or I'm standing up to pee, I need to move the rock away from the boulder. That's
that's kind of biblical,
relaxation.
actually.
It is, right,
Yes.
exactly. I usually describe bats in the cave, but it could be any number of things in the cave.
Yeah.
So if I move the boulder away, that's relaxation. I let all the bats fly out, and only when all the bats have flown out am I closing again. So getting that sphincteric control to end my urination.
Ah,
And I think the problems people experience around this often have to do with, especially for people with a lot of stress and nervous system regulation, has a lot to do with pelvic floor function. But a lot of times, if we're running around, we sit down to pee or we're standing there to pee, we think we're done, but really our mind is on whatever we're going to do next.
ah,
So some of us, even without realizing it, prematurely close those sphincter muscles. We're
ah,
not totally empty, and that can lead to any number of issues. So the most important thing is just standing or sitting there. Usually for my patients who have this as an issue, I'll have them relax, do some diaphragmatic breathing, count to 10 while they're relaxed. And then if they're done peeing at that point, great, move along. But a lot of people are really surprised that when they do that 10 count and really focus on relaxing in those 10 seconds, that sometimes you'll pee like a whole other bladder's worth and you really thought you were
wow.
done. So leads to a ton of issues for people. But
That is,
generally,
yeah.
a combination of contraction and relaxation to pee.
The part that I find fascinating is I know, like doing a Kegel, basically, I know how to stop the flow. That's conscious. I can do that consciously. I just don't know
Hmm.
how to start it consciously other than the fact that it works. But you're
Yeah.
describing it's a relaxation of something that doesn't appear to be under direct conscious control. Is that part accurate? Or
Um,
I can close it, I
so
guess. So maybe I should,
Well, but your bladder's full. You know,
well, yeah, but
it's got to
even,
come out.
even if it isn't,
Yeah.
like if I want to make sure to pee before we're going out, even though I'm not
Right.
really full,
Right.
I can do that.
Yeah.
How the hell am I doing that? I mean,
yeah.
yeah.
So it is, we have sphincters that are under voluntary and involuntary control.
Yeah.
The most superficial one, the one that says, finally, I'm going to pee, that's under voluntary control.
Hmm.
And so that's the one when you're doing a Kegel and you're contracting your whole pelvic floor, but you could be closing there.
Yeah.
So you're right. We do have control of urination, or we should, right? That's why someone might see me. But we
Yeah.
should have control. But there was something else you said. Oh, sometimes people think that to start a stream that there is more effort involved, and there
Mm.
might be a little effort involved. It's really a pressure management thing when we think about
Hmm.
having a bowel movement. But
Yeah.
again, for urination, it should be effortless. It's just relaxing that muscle.
Yeah.
And when people push to pee, either to start their stream or to kind of get the last bit out, if they don't feel completely empty, that can lead to a lot of issues too, especially
Uh,
for women when we think about prolapse.
it reminds me of the of falling asleep. that you
Mm.
can't make yourself fall asleep. You can only stop yourself from doing the things that prevent you from falling asleep.
Mhm.
And I think it's a similar sort of process. It's like you can let yourself pee, but you can't, but trying to make yourself pee is often counterproductive. That's what am I understanding that right?
You are, and that gets a little bit to something you mentioned a minute ago. I think you were saying before you leave the house or whatever,
Yeah.
that you might go just in case. And this is maybe more information than you wanted, but it's
No, no,
important
this,
information.
I'm
That's
finding it
why you're
fascinating.
here.
Yeah.
Very good, very good.
Yeah.
So I should never be going just in case. And a lot of going just in case leads to issues that have people needing to see a pelvic floor PT or having incontinence. So
Wow.
it's normal. Let's say when my bladder is like 80% full, the stretch receptors in my bladder are sending signals to my brain that give me that little feeling of urgency that say, okay, we're getting full. We're going to have to pee soon.
Yeah.
And as my bladder gets more and more full, finally I say, oh, I feel that urgency really strongly. I know I need to go address it, right? If I start to go when I have just a little bit of urgency or just in case, I start to retrain my brain and my bladder to say, don't give me urgency at 80%,
Ah,
give it to me at
yeah.
70 and 60 and 50 and 40,
Sure.
until a lot of people have near constant urgency. They think they have symptoms of UTI. But actually, it's just that they've really disrupted this relationship between brain and bladder, and they're not
Oh,
getting the signals that tell them that they're truly full and should go. And of course, this can go in the other direction too if we hold it for too long. So
Mhm.
ideally, people should be going every 2 to 4 hours if they're well hydrated, and that's in the presence of normal urgency. It creeps up on me. It's not an emergency. It happens slowly, and then I can go address it.
Yeah.
But
Wow.
people are always surprised to hear we shouldn't be going just in case. It's like our moms told us from a young age getting into the car, and I
right.
understand why, right? Like, are you sure you don't have to
That's
go?
right.
It's like, ugh, we're developing bad habits
Wow.
without realizing it.
I was not expecting to learn about this in this conversation.
I'm so glad it does affect so many people, and
Yeah.
it's like I joke too. I think pelvic floor, by the time you're having issues with pelvic floor, it's like the very last thing talking to you to say, okay, you have to start paying attention to your body and its signals. And again, nervous system regulation has a lot to do with it. When have you ever seen a scared animal poop or pee? Never. We need to
Yeah.
be sure that we're in this rest and digest state and not this fight or flight state to have normal function.
Mhm.
But I think for most people, it's like we're running, running, running. We're doing so many different things. We're really stressed out. And so we kind of at last lose touch with those normal signals that tell us, I drank
Mm.
enough water today. There's a little bit of urgency. I'm going to sit down and relax. I'm going to wait till my bladder's empty, and then I'm going to keep going. And it seems silly, but not many people are doing that.
Mm.
Well,
Well,
getting back to sex.
yes.
So
Yeah.
Let's get back to that.
since we're
Yes.
couples therapy program, you've
Mhm.
noted that women often are wrongfully accused of denying sex to men. Can you
Mm.
elaborate a little bit on that?
Yeah, so I would love to talk a little bit about the dynamic of giving and receiving in
Mm.
just a
Okay.
moment, because I think it really has to do with that giving and receiving in our day to day, and also giving and receiving in bed. But as one little example of this, so I had a couple who I was working with the woman first, and then I met both she and her boyfriend. And when I was talking to her, she had a lot of issues even around her body and being really preoccupied with how she looked. And when the two of them came in together, we were talking about, oh, candlelight can be nice, things like that. And he really liked having sex in bright lighting. He liked to see everything. And I thought, if you really wanted to have sex, I think you might consider that candlelight is a nice compromise so that she's feeling comfortable and everyone's getting what they want, right?
Well, and
Um,
if you really want to have sex with this particular woman,
absolutely,
maybe you ought to listen to
absolutely.
what she wants.
Absolutely,
Yeah.
absolutely. And
Yeah.
I think when it comes to giving and receiving, that's just one example where this was not a couple that had children, but where for a lot of couples, because of stereotypical gender roles, and I think this is changing, and certainly it's not every couple, but it's like you have a woman who all day long is tending to her children, the household, a lot of the emotional labor type of things that we think of. And then when it comes to sex, there are lots of different things we could talk about related to this, but I think we usually think about penis and vagina sex, which is not typically the thing that most women find physically pleasurable or the thing that's going to bring most women to orgasm. And so it's like, okay, she gets to the end of her day, she's been running around all day, she's been giving, giving, giving. And then they have this idea that sex is going to be penis and vagina sex. Who knows what kind of foreplay exists? The focus really is not on her pleasure. It's on this just this classic definition, I think. And so it ends up being another area in which she has to give. So
Mm.
she has to really be a vessel for someone else's enjoyment, or she's performing in some way to provide enjoyment and not really going after the thing that she might be really interested in. And as another aside, and in my own experience, something I realized in my marriage was I was putting on an Academy Award winning performance so many times where I would make sounds and I would give nonverbal feedback and all of these things to my partner. And he had an orgasm most times. I didn't always, but he was able to have an orgasm in really perfect silence. And I'm not saying that's ideal either, but I think it's interesting that we have this dynamic often where it's like, so why do I feel compelled to people please in this way or to give in this way or to do these things and ultimately not maybe be satisfied? And I'm with someone who really has no problem taking his satisfaction, acting the way he feels, things like that. And so I think it's those dynamics between couples where we just need to be a little more creative around maybe women being able to change up how they approach giving and how they approach their desire and what they're asking for, and where maybe men and women can start to look at things beyond penetration in particular, that could help with their enjoyment.
Mhm. Yeah, it's interesting that phenomenon of, actually, I've got a few a few different threads I can follow on that, but
Mm,
that idea that something you said earlier, like why would anybody, man or woman, but we'll focus on women. Why would women want to participate in something that isn't fun? And
mhm,
I'm always impressed that we'll find with both men and women, people want to be generous, they want to be giving.
mhm,
But I love the paradox that when it comes to sexual relationships, the thing that seems to work for most people in one way or another is a combination of kind of radical generosity and radical selfishness, both. It's like,
mm,
a lot of people will feel like I want my partner to be overwhelmed with desire for me. And
mhm,
that's a selfish feeling for them. I want to
mhm,
experience that I'm causing that in them, and yet I also
mhm,
want them to be generous, and vice versa.
mhm,
I want to be generous,
mhm.
but I also want to be selfish. It's a tricky balance sometimes for a lot of folks.
Yeah, and I think that gets into ideas of giving, receiving, and leading and following.
Hmm.
So we can't give and receive at the same time, really, to be truly present with either. And we also can't lead and follow at the same time if we're
Yeah.
going to be truly present. And so I think what someone enjoys might change from interaction to interaction. And even if we're not explicit about it, I think it can be helpful to think, okay, in this interaction, maybe I'm leading and giving, and my partner is receiving and following. And when I focus on that, it allows my partner to really go into receiving and letting go and not having to guide the action. So they could still give me feedback, but they can really just bask in receiving. And it also allows the giver to feel good about truly giving and giving not in a way that's looking for a reaction from their partner necessarily, but giving in a way that is free in the giving, because I think that's really appealing and arousing to a lot of people too.
Hmm.
I think the challenge comes often, and this is kind of what I mean when I talk about even my own experience with moaning, performing, doing all these things. So I'm really putting on the act of the whole thing, but I'm not necessarily getting lost in my giving or receiving. I'm kind of distracted by this extra thing that I have to do. And so I think stopping to really consider what am I doing in this moment and what's my partner doing and how's that dynamic interacting is really helpful.
And how do you help women? You mentioned earlier the dyspareunia. How do you help women that do have pain during sex? What are some either exercises or implements that they can use to help alleviate that? And number one is, well, first, not to have the pain, but also to take away the anxiety of the pain. How do you go about treating that?
Yeah. So, first of all, especially depending on where a woman is in her life and her cycle, hormone changes and tissue changes. If I have burning pain with external touch or internal penetration, usually burning or a feeling of rawness, that often can be improved with topical estrogen or hyaluronic acid is something people do over the counter now. So definitely worth talking to a doctor about, but that's the kind of pain usually that will respond to that type of intervention. When I'm talking about pain that has to do with increased tension, it's not rocket science, I guess. What I'm usually doing is working with progressive dilators.
Mhm.
So we might start, depending on what someone can tolerate, with something teeny, teeny, tiny, and working our way up to potentially, let's say, the size of a partner, if that's something that they were trying to be comfortable with. And usually I tell patients who have pain with sex and it's this tension issue, it works at cross purposes or two purposes, I should say, to say for the next 2 months or so, can we take penetration with your partner off the table?
Mhm.
And I like that because it takes the pressure away from them having to say yes to something that's uncomfortable for them. They're not going to have pleasure when they're having to grin and bear it. And I think it also says, okay, let's call it a medical necessity. So you don't
Mhm.
have to make any excuses for yourself. We're saying for us to overcome this problem once and for all, we're not going to force it for 2 months. And in that 2 months, I'll have someone work with the progressive dilator program. And the key is throughout, no matter what the size is or whatever, we're focused on pain or discomfort is always tolerable or better. And that's physical discomfort, but it's also mental discomfort. So there are some people I see who are sexually active with men. With penetration, it's very painful to them. Who, when I introduce even the smallest dilator, it like gives them the heebie-jeebies. They're really uncomfortable around it. And I think that is really someone who we have to dial it way back. And she might have to get comfortable just with looking at a dilator first, or with
Mhm.
looking at her own anatomy, or holding a dilator in her hand. And so that psychological comfort is happening in tandem with the physical comfort, so that by the time we go back to, okay, can I tolerate penetration with a partner? We have a really good understanding of what feels okay to us. We need really good communication in the relationship because we need to be able to say, stop and slow down. Maybe it's a woman on top in a way that she really can drive the action. But by the time we get back to being with the partner, we need to have done a lot of work by ourselves to get
Yeah,
to that point. And women ask all
that's
the time, like, "Oh, can I use the dilator with my partner?" And it's like, that's not the
uh,
point, actually. I appreciate
yeah.
that's a giving attitude that is not serving you.
Yeah, yeah. It's interesting that of course you're also touching on a lot of issues that come up with respect to sexual trauma. And
Mhm.
processing trauma is a lot of the same idea of being able to, visit something that has some overlap with some horrible thing that happened to someone and
Mhm.
not freaking out over the memory. It's
Yep.
it's transforming the memory into something that is safe. The memory's safe. The event was horrible, but the memory's safe. And
Yep.
then you don't have to go into fight or flight or freeze or whatever when something reminds you of it. And that's,
Absolutely.
of course, a lot of the work you're doing, I'm guessing. Well, I'm more than guessing. I've worked with a lot of folks over the years. A lot of that sort of physical work can have that very effect of helping to process the trauma. And I'm guessing
Absolutely.
you encounter that a fair amount.
I do. And I would say that is really where I refer to a therapist and someone who's
Yeah,
meant to deal with that sort of thing. So, EMDR and
I'm
things like
trained in
that.
EMDR. Yeah, yeah,
EMDR is huge. It's definitely had an impact in my life and in a lot of my patients' lives. So I think if someone has that real halting kind of trauma or PTSD stuff, or even if it's more mild than that, that's where definitely beyond my scope of practice. And I think
yeah.
therapy has a huge role to play.
It does. What's interesting, I think, as you're talking about this, therapy does, of course, have a huge role to play. MDR is great. I'm thinking now, if I were doing that sort of work now, I haven't been doing it for a while, I would be much quicker, I think, to recommend a pelvic floor therapist in combination with that work,
Hmm.
because I
Yeah.
think that lets you get to some of the, you can process trauma from the bottom up and the top down, sort of literally from the bottom up in your case,
Yep.
and that can be really much more effective, I think, than simply dealing with the psychological aspects because they're all related, mind, body.
I totally agree. And vice versa for me, exactly. If you know you have a trauma history, or if you even have sometimes people may not disclose that to me, but they're so averse to their own anatomy or to holding that dilator or whatever, that it's
Mhm.
like something else is going on. And if we're only working on the mechanical aspects, and sure, graded exposure, and there is that mental piece, but if that's our focus and you're not looking at the deeper issues that might be causing this, you're not going to have a very easy time getting into that nervous system regulated state that we need you to be in for this
Yeah.
ultimately to be successful in the long term.
Yeah.
Right.
So you've also talked about what queer relationships can teach straight relationships.
Mm.
And you know, we one of the people we interviewed early on in our practice actually was the rabbi of our synagogue, who happens to be a gay man, and he had a lot to say about that very topic. We found, as a straight couple, we found it. I found it anyway.
Yeah, yeah,
We found
very
it
much
really
so.
fascinating. So yeah, could you address that? Like, what do queer relationships have to teach straight people?
Definitely. And I would love to hear what your rabbi had to say too.
Yeah, yeah,
So I think this comes a lot. This is my personal experience overlapping with my professional interest. So, like I said, I had been married to a man most of my experiences until I was, um, in my mid 30s, really, were with men, my intimate relationships. I wasn't missing anything that I was aware of. It wasn't until the end and all the things I already described to you that I started to question a few things. But everything was fine. And I think when I divorced and when I realized my attraction for women and then had more experiences with women, I realized, oh, when I'm not bound by any gender stereotype, it really opens the world to follow your interest and what you enjoy. And so I think there are ways that queer relationships mimic heteronormativity. I think there's a big top and bottom culture and some of that. And we could think about giving and receiving even in some ways
Mhm.
like that. But I think in straight relationship, it is typical, even if it doesn't really align with what someone enjoys, to have a man lead, and a woman follow. And giving and receiving can be a little bit different, and that can be a little more varied. But I think in queer relationships, it's really about, well, there's no expectation of me. And so what do I enjoy?
Yeah.
And I think, again, that can change interaction to interaction. There are some people who know what they like and they do the same thing over and over. But I just started to realize, oh, I was receiving a whole lot, or there were only a few things in my toolbox that I was going to over and over. Um, because I just didn't know any different. And I think it's really funny. Before I had experiences as a lesbian, I always wondered, and I think a lot of straight people do, like, what do they do to have sex? What, I can't imagine. If you're not getting to the main event, what's going on? And I think that is the thing that really blew my mind the most. So,
Mhm.
when, as long as I was having sex with men, I'm very candid about this, clearly with you all and with my patients too. It's like there was one way that I had an orgasm every single time, except for one
Mhm.
time in my life with men, right? And I know that's not true for everybody, but it was
Yeah.
always the same thing. And it related to penetration and to particular
Mhm.
positioning. And when I wasn't with men anymore, I realized, oh my gosh, actually, I can have an orgasm 1,000 different ways.
Mhm.
We just, in the context of a straight relationship, it was like, this is all the appetizer to get to the main course.
Yeah.
And so we
Yeah.
didn't spend a lot of time on the appetizers because
Ah,
that wasn't the point. That was foreplay,
Yeah.
right?
Yeah.
And then when it became like, oh, this actually can be the main course and often is, then I had a
Yeah.
blast.
It's so interesting. I think, again, from a straight perspective, hearing about that, the a couple of things I take from that, one being the part about if you have all these foregone conclusions, it is incredibly limiting and it doesn't work for everybody. In fact, doesn't work for
Right.
most people, or at least many people,
Right.
especially women. I hear from what,
Mhm.
not to mansplain to the women in the conversation.
We would agree, I'm sure.
Yeah.
we agree.
And also the other thing, and this is one of the things our rabbi talked about. One of the other things, when you don't have those foregone conclusions, when it's like, well, okay, we don't already know who's the quote unquote man and who's the quote unquote woman. Then
Yes.
all of a sudden you have to think about it and talk about it, or at least pretend
Yes.
maybe think about it and talk about it. And that's the other huge thing for people in straight relationships to take from it. It's like, turns out you can actually think about and talk about stuff outside of those foregone conclusions. And when you do that,
Yes.
all kinds of stuff opens up.
Yes,
And I think
exactly.
that's a huge thing that
Yeah,
yeah.
definitely. A lot more talking
Yes.
about it.
Yeah.
Yeah, and that's what I feel that reframing too around anything we enjoy doing, you don't have to convince us to do. That's where I think
Yes.
that helps to open it up too, because it's like, okay, it is a foregone conclusion, I think. Like she's tired and she has low libido. He has higher libido and he's looking for sex and she's not.
Yeah.
And as long as we assume that, well, what's the solution? We really don't
Yeah.
have anywhere to
Yeah.
go from there. And I think when we start to say, oh no, there's something missing. You're not maybe fully exploring the thing that you might enjoy. And when we reframe it like that and say, so there's more to think about, then I think we can also get away from, oh yeah, this isn't working for me. If
Yeah.
I
Yeah.
open my perspective to the fact that there may be something else that does,
Hmm.
how could I start to look at that? And there are lots of ways to access that exploration too.
Oh yeah, and that often is very challenging to both the man and a woman in a heterosexual relationship. That
Mhm.
that for a lot of us as men, we have to learn to not invest our egos in thinking that, oh, if she's not enjoying it that much, what kind of a man am I? As
Mhm.
opposed to I'm
Yes.
often trying to say to guys, when she's telling you she doesn't like that and she does like this, she's offering you the queen, the keys to the queendom. It's like for God's sake,
Absolutely.
she's giving you an enormous gift, and you'll
Absolutely.
have fun with that, right? If you see that you're driving her nuts in all the right
If you
ways,
listen
if you listen, it's like
and
it'll be more fun for you. But for a lot of guys, we haven't learned that. And for a lot of the women in those relationships, they haven't learned it either. And of course, a lot of the women have taken in this idea that says, oh no, my God, if I actually have desires that I can express or try to tell
Mm,
them, what kind of a woman am I being? I'm not allowed to do
yes.
that. And so many of the women,
blame the media. You know,
yeah,
you go to a movie and it's like wham bam and it's like ha, 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 and the men and the women are huffing and and she's like she's having this orgasm and
Ah,
it's like it's not really gonna happen like that, honey.
totally,
So
totally.
we
I
have this
agree.
expectation that it's just gonna happen, and sometimes it
Right.
does, but not all the time.
Right. And why would we know any different if that's what we see
Exactly.
everywhere? We don't
yeah,
really see it anywhere else. But the other thing you're reminding me of, Bruce, is when we think about, we are talking a lot about how women are limited in this way, but I totally agree. Men are really limited too. And I think,
oh yeah,
especially when it comes to erectile dysfunction, right?
yes,
If I think that penetration is the only thing, then as soon as I start to have some issue with my erections and my ability to have penetrative sex, you're right. What kind of man am I? And if
oh
I have a
yeah.
huge menu of options, I can feel great no matter what's going on because
But
it's not
then
all
that's
about that
okay.
one thing.
Yeah, and of
Exactly.
course you get this particularly toxic cycle in a heterosexual couple where the man's penis doesn't work the way he wants it to. The woman takes it personally and thinks, "Oh no, he doesn't love me. He doesn't find
Oh
me
my
attractive."
gosh.
And sometimes gets angry, like you must be having an affair, because after
Right.
all, we know that men are constantly ready for sex on a moment's notice with anybody at any time, which isn't
Absolutely.
true either. And so that leads to a really vicious cycle. And it's fascinating that the ways when people can untangle that a bit, then they can
Yes.
relax and then they see, then they can actually see maybe there's some other possibilities.
Yeah.
Absolutely. Absolutely. Well, and the number of people too, especially when I ask older women, oh, do you have sex and are you happy with frequency? And they say no. And then they'll say, oh, well, we have bad knees, or oh, there's erectile dysfunction or whatever. And it's like, how
Mhm.
sad. That's the thing? No way. No way.
Yeah, yeah.
Doesn't have to limit us.
So what else should we be asking you about?
Let's see. I mean, y'all covered a ton of it. I would like to, I mean, the giving and receiving thing, I think, is the most revelatory for most of the people I work with. And I think we touched on it a little bit, but the idea that we can't do both at once. The other piece of that is it's typical that the dynamic that works easiest, and it's not the only way, is a giving, leading, receiving, following dynamic. And it
Mm,
doesn't matter who in the partnership is playing that role, but when we can really say, okay, I'm going to lead the action. I'm going to give me feedback as you need to. Absolutely. But I'm going to get lost in giving and you can get lost in receiving. I think that can be really helpful. There are, of course, dynamics that are about giving and following. And
mhm.
there are lots of, I don't know how much you or your audience would be familiar with. There are a lot of terms in the queer community related to this. So you can be what's called a power bottom. So you're someone who's guiding the action, but you're receiving. Or you can be a
Ah,
soft top. So you're someone who's following, but you're doing the giving. And
wow.
I think
I
those
hadn't heard
are
those terms. Yeah. Interesting.
a whole new
So
world.
much on this show, I will tell you.
Very good. I'm so glad. That dynamic can work too. And I think
Mhm.
that looks a little bit more like, okay, I want to receive, but I'm going to tell you exactly how I want to
Yeah.
receive.
Yeah, the
And that
BDSM world has a lot to say about that as well. That's huge.
absolutely.
I do have some familiarity with by talking with it. We're not, how can I put this? We're not in that world, but I have learned a lot by talking with folks who are. Yeah.
Absolutely. And actually, so BDSM, what I'm describing is this matrix that is kind of like the most elementary education we can get on this sort of thing.
Hmm.
BDSM takes it to a whole new level, and we start to get into the
Yes.
kink community and all of that. They definitely have a lot more to say about this. But I even think for people who are not in that world, just being a little more conscious of, okay, what am I doing in this moment? What is my partner doing? And whether we're explicit or not, we can get much more, again, lost in the act of giving, receiving, leading, following when we're clear in our minds about what we're doing. And then, especially when we go back to what we were talking about with women and giving, giving, giving all the time, when she knows in this interaction, I'm following. Whether
Hmm.
she's giving or receiving, I'm
Hmm.
following. I don't have to tell somebody else what to do. I don't have to lead the action. I'm going to react how I feel. I don't have to put on that Academy Award winning performance.
Yeah.
Then I think it really makes a difference for her enjoyment often. So
Yeah.
I think that's a useful piece. And then the only other thing, well, there are so many things actually,
Of
but
course.
something else I think about a lot, and there's an author, you all may even be familiar with him. I'm trying to remember his name. His book, it's out of print. I could definitely follow up with you about it, but there's an author who has this idea about peak sexual experiences. And when we think about women struggling to identify what it is that they might enjoy, it can be really helpful to go back in their sexual history and think, what are the experiences that stick with me? For any reason, I'm not going to judge why, just what are the things that really stick with me? In particular, as things that really turned me on.
Mm.
And then how can I use those experiences to think, what happened? Was it a power dynamic? Was it environmental, a way I felt, whatever? What was it about that peak experience that really did it for me? And if I can identify that, how could I bring elements of my peak experience to my current relationship? And
Mm.
it doesn't even mean telling a partner what that experience was, because I think jealousy being what it is and all that, not everyone wants to know the
Mhm.
details. But even if you can just in your mind kind of have a sense of what are those experiences, so that I can better communicate what I might enjoy. That can be
Mm.
really helpful.
Yeah, that's reminding me of we interviewed Artemisia Devine, who
Mhm.
talks about fantasies. She's a
Mm,
former sex worker herself, and she developed this practice around, she was a dominatrix. She
mm,
developed this practice around helping couples understand their fantasies and how that fits into their life. And it's very similar to what you're describing. And
mm,
I was just talking with a couple about this the other day, that fantasy life, if you can, again, you don't always have to share everything, but if you can
mhm,
let yourself know what those things are that feel like they could lead you to peak experience. That's
mhm,
something. The other thing you've been saying, you mentioned a couple times, and I really like that concept, getting lost in it. The idea of
mhm,
getting lost in it, on the one hand, it sounds kind of scary. It's like, oh, you're going to get lost. On the other hand, it connects with what I've referred to, not just me, as sacred sex. It's like,
mhm,
there's plain old sex, there's good sex, which is where you show up and you're physically present. And then there's
mhm.
sacred sex, which is you get lost. It's like not
Yes,
just about you and not just about your partner, it's about the universe at that point.
yes,
And
yes.
that notion of what can lead you into those peak experiences often involves letting yourself know stuff that it's a little scary to know. Because a lot of times,
Right.
I'm sure you realize a lot of those fantasies people have are both not politically correct and scary as hell if you actually thought of enacting them.
Absolutely, absolutely. And
Yeah.
that's where I also think it's helpful to remember, taboo is sexy for most people. For
Yes.
most people,
Mhm.
their fantasies involve some element of taboo. So if
Yeah.
we just appreciate that and say, of course, this is how human brains work, I'm not going to judge it. I think that can
Yeah.
be really helpful for sure. There was something else you just said, though. I would love to talk for a second about sacred sex and embodiment because I think that's huge.
Sure.
But the other thing I was thinking, and I have a lot of little nuggets that I consider that kind of drive my work. But the other piece is, to me, sex is one of the few places where adults can play, they can have
Mhm.
imagination.
Mhm.
And I love it because it doesn't cost anything, or it doesn't have to cost anything. And so I think to not have it, again, there are asexual people, there is low libido, but to not have sex for any other reason is we're robbed, because where
Mhm.
else? Kids get to play all the time. Where
Mhm.
as adults do we get to let go and have that creativity and fun and delight? And it's really one of the few outlets where it's acceptable for us to do that, taboo or no.
Yeah.
Mhm.
Well,
And it
Mhm.
enhances a relationship, hopefully.
Absolutely.
yeah.
Absolutely.
When it
Right.
does, it does.
Yeah.
Right.
And
Right.
when it doesn't,
Ideally.
it's interesting because when it doesn't, I do meet, of course, folks where they love each other, they like each other, they get along well, and they simply aren't sexually compatible. That does
Yeah.
happen. And often it's painful for them to discover it. And then when they discover it, often, more often than not, it leads them to maybe not try to be in a sexual relationship anymore.
Right.
Maybe if they were married, maybe divorced, whatever. But they
Hmm.
can also appreciate each other in ways they never could. And, if they're parents of the
Hmm.
same kid, they can get along really well.
Yep.
And they discover that sort of thing. So yeah, it works. It either enhances a relationship or it indicates that the relationship is not the right one.
Mhm.
But either of those can be growth experiences. Right? Either of those can be
Absolutely.
good. Yeah. Yeah.
Absolutely. And I think if you have a partner, there's a great podcaster, Dan Savage. He has a
Oh,
column,
sure.
Savage Love. Yeah. And
Yeah.
his concept of good, giving, and game.
Yes, the three
And
Gs.
I
Yeah.
think, right, even if you're not
Yeah.
super compatible or you think you're not compatible, if you have a partner who's game and you're willing to flip flop and you're not always doing the same thing that you both find amazingly hot, if you
Mhm.
love to give and your game, then you might be able to have access to a lot of different things that, even if they're not your first choice, you can
Oh, sure.
really enjoy.
Yeah, no two individuals are apt to be exactly aligned on what turns them on. So yeah,
Absolutely.
and that's part of the fun. That's part of the growth.
Right.
It's like, oh, never thought of that.
Exactly.
Wow.
Exactly.
Oh, cool.
Exactly.
Yeah, yeah.
Great. And then the only other thing you mentioned when it comes to sacred sex that made me think of is, so sometimes there's a great book, Urban Tantra, that I sometimes recommend to people. Barbara Carrellis
Oh,
wrote
don't
it.
know that one. Mm.
Very accessible. I try to have folks suspend whatever beliefs they have about religion, or you don't have to get into that level of it with tantra to me. But something I do appreciate about tantra, and sacred sex and ideas like that, is the level of embodiment and getting connected to sensation that a lot of that involves. And again, when we think about nervous system regulation and all these other things we've been talking about, I cannot be present if I cannot be present with sensation in other areas of my life throughout the day. And so
Yeah.
getting a practice that has to do with slowing down, enjoying my meal, enjoying when I walk, the feeling of the air on my face, and having any opportunity in my day to start getting connected to sensation, I think really enhances, and it starts there, to be able to get into that level of depth, I think, when we're in sexual relationship too.
Mm.
So
And
true.
good for managing distraction.
Yes, indeed. So how can folks get in touch with you?
Yeah, so I'm on a few different social media platforms, although I have to admit it doesn't bring me personally a whole lot of joy, so I'm less reliable on there.
Sort of Marie
Um,
Kondo that one out, sort of
yeah,
like,
exactly,
doesn't
exactly.
bring me joy. That's
Yes,
fine.
exactly,
Yeah.
exactly. But I'm on Substack, I'm on Instagram. I'm probably most active on Substack though, and I have a website as well. It's rachelmacneilintimacycoaching.com. And everything I post on Substack, I also post on my blog on my website, so folks
Ah,
can
great.
certainly find me there.
Yep.
Great.
We will put that link in the notes for this episode. Well,
Perfect.
thanks so
Sounds
much for
great.
doing this. Yeah,
Yes,
thank you
thank
so
Thank you
you.
much.
both so
I learned
much. It was
so
great
much.
talking to you.
Yeah,
Yes, I'm
talking
so
to
glad we
you
got to
too.
talk so much about pelvic floor too.
Yeah, really.
Welcome back. We hope you enjoyed that interview as much as we enjoyed having Rachel.
Absolutely. So please get our books, review our books, all that kind of stuff.
Like
And
us, follow us, tell your friends, all that stuff.
yeah.
Share us.
And what should people do if they would like to suggest themselves as a guest or suggest a
Ah,
topic, or how might they get in
how
touch with
can they
us?
get in touch with us? They can
Yeah.
go to our website, ctin7.com. CT as in couples therapy, in 7, the numeral 7.com.
ctn7.com. Go there. You'll find ways of getting in touch with us. You'll find access to all of our past episodes, at least the audio versions. The video versions you get, there's a link there, and you can get to the video versions as well through my blog,
Right.
brucechalmer.com/blog. But go to ctn7.com and you'll get in touch with us. And please, as Judy was saying, like us and rate us and all that kind of, subscribe to us, all that stuff. And tell your friends.
Exactly.
And so until next time,
Remember, be kind
don't panic.
and have faith.